Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café, and today I have with me Dr. Nicole Robinson, and she's a licensed pharmacist, a functional medicine practitioner, and also a certified Mercier therapist. And she began basically her career in 2011 as an Army pharmacist. And long story short, I think you ended up more going with functional medicine and also with a Mercier therapy.
Yes.
Well, welcome, number one. And why don't you tell us a little bit what, well, first, what is Mercier therapy? Because I'm not familiar with it.
Yeah, well, thank you so much for having me on the podcast today. And Mercier therapy is a deep tissue manipulation on the organs of the pelvis, so the uterus and the ovaries. And there's some work on the lower back as well to help relieve restrictions and tension in the area and to really optimize blood flow, because with a lot of our everyday lives, we're so stressed and we're not eating healthy and we're exposed to all of these endocrine disrupting chemicals that takes a toll on all of the systems of our body, including our reproductive organs. So to have a Mercier therapist get in there and kind of increase that mobility and that blood flow, we can see increased function.
That makes sense. And your focus is fertility, right? Woman and fertility, is that correct?
So right now I see anybody that comes into my office, but mostly that ends up being women who are looking for help with, any issues having to do with their health, specifically hormones. I would say my passion though is women that are dealing with infertility, because I've gone through it myself and it really opened up a lot of doors to personal healing for me. And I realized that in order to get my body ready to create another life, I had to be healthy myself. So I really love helping women on that journey.
So does that have anything to do with you moving away from pharmacy to more holistic ways of looking at the body?
100%. Yes.
Because I was going to say, it's not, actually, it's not shocking at all, as more people are sort of realizing that, quick fixes and band-aids don't get to the root of what's wrong.
Yes.
I think there's a big shift now for people, wanting to know more about what can my body actually do and what can help it do what it can do, rather than, so-called fix it, which doesn't really fix it. But so tell us a little bit, how did you end up going into pharmacy in the first place, and what was your, because in a sense it's still the calling to help people, right?
Sure.
Yeah.
So I think it really started when I was a kid. I was diagnosed with an autoimmune disease when I was about 9 years old, and I went through a lot of pain and suffering with that, and was using the conventional medicine model, and that ended up being a year of high dose steroids that helped with the symptoms short term, like you were just saying. But then I ended up with a lot of long-term things going on, gut issues, sinus issues. I'm pretty sure infertility is part of that. And I think it took a toll on, my reproductive health as well. And so I really, just going through all of that had me wanting to help people. And I wanted to, help people feel better. And so when I was in high school, I was trying to figure out, where in the healthcare field do I see myself? And I ended up with pharmacy. And I think that was mostly just because I was like, I don't like dealing with blood and all of those things. So I'll just stick with being a pharmacist. And so, I went through school and got my degree. And I sort of felt like I was helping people, I guess, but it's so busy that you kind of get caught up in the amount that you're doing, the numbers, and it's easy to lose sight of the fact that these are people in front of
Yeah.
you. And I practiced traditional pharmacy for almost 10 years before I started to really expand my horizons, if you will. And
Yep.
I just started noticing that people weren't getting better. Everything
Right.
was about treating symptoms and maintaining what little health these people might have had. Nobody ever got better. And I think it was a series of, personally looking for other answers and talking to different people that had tried holistic methods to get their health back. And I, stumbled across stories of people healing from autoimmune disease and diabetes and high blood pressure and cancer. And I was just like, is this even real? In school, it was nobody got better from any of those things.
Yeah.
And so I was super intrigued. And once I started kind of really diving into functional medicine, I could not unsee it. And I knew that I was going to have to make a change. I could not do this for the rest of my life. And so I started doing a course to get certified. And I talked to my uncle, who's actually a chiropractor. He owns his own practice. And I was just trying to get some ideas of, as a pharmacist, how can I make this work? And with him owning his own practice, he said, well, why don't you just get certified and come work for me? And I said, okay. So for about the last year and a half, I have been working, I have an office in his chiropractic clinic, and we work as a team to see patients for functional medicine. And it's just, it doesn't even feel like work. Like I really feel like I'm where I'm supposed to be. And the transformations are just, they're so amazing. I love it.
Yeah, well, it's great. I always find that it's also really great for people to hear this, because myself, I'm a naturopathic physician for 30 years. I was because I am no longer practicing here in Canada. And yeah, it's amazing. People come as a last resort.
Yes.
Because they've tried everything, and then it's like, oh, okay, prove it. And it's like, what are we proving? It's your body, it's your health, your life. It's like either we honor that and we really work with understanding it fully, or we just throw a bunch of drugs at it. It's like it's really, it's shocking how long it's taken for people to shift, and to, and I know many doctors that ended up in my practice too. They're saying, oh, you're so lucky. You actually get to help people, and I'm like, yeah, it must be very depressing. I
Yes.
don't need an emergency, and there's place for everyone in this planet, but for chronic diseases and for chronic conditions and autoimmune diseases, and I would say infertility too, it's not like drug fixable.
Right.
Yes.
Yeah. I mean, and I feel like too with medications, a lot of times, I would see people get started with one, and then they end up adding more to counteract the side effects of the first one, and it doesn't make logical sense, to start with the body and support it so that it can heal. That makes sense.
Right. Yeah. I hear you. You no longer have a fertility issue. You have children in the background.
Yes, I do have two in the background.
I'm saying that lovingly, don't worry. I think
Ah,
it's in the context of all of this, it's perfect.
my goodness.
And happy kids.
Yes,
Uh,
yes.
have you noticed in the past, year and a half or so, an increase um, of infertility or miscarriages or anything like that from these latest pharmaceutical endeavors?
Oh, definitely. And I don't even think we need to wait for the studies and the research to come out on this. Like, we know people in our own families and in our circles of friends. I know women that are now having issues with infertility, women that, you know, have kind of bought into, certain things that have been coming down the pipeline, and who were some even pregnant at the time and ended up, having very difficult pregnancies, or, premature deliveries and things. And the infertility numbers are, I feel like, just through the roof. I feel like I know so many women that are having issues.
Yeah, yeah. Well, it's I mean, now we have access to the Pfizer report, which was going to be put off for 75 years so that we would never know what was happening.
Yeah,
And even
wild.
the study itself, has 28 out of 29 of the women who happened to be pregnant miscarried, and then they didn't bother continuing to study this, and then suddenly it's safe and effective for pregnant women, and we have all these obstetricians saying this when we're in a trial. I found this so, I mean, it's not just corrupt, it's sad. These are human lives, that of well-meaning people who think they're doing the right thing because they, like you say, they bought into that narrative. And yeah, it's just, in Canada we're so censored that yeah, we really can't speak about it at all. Like there's nothing, there's not even like so-called Fox News where you could get a little bit.
Yeah, and I think it just goes back to, like you said, the narrative, and really buying into, everything that the medical community comes out with, and seeing that as dogma
Yeah.
versus people thinking for themselves. Like, I don't even think, I mean, as far as vaccines in school, it was like in a weekend, we learned about the vaccine schedule, and here's your certification, you know, go
Mhm.
start administering these. And
Mhm.
I I knew very little about it. And I mean, I didn't know very many other pharmacists that did. It was just like, okay, well, go through this training and now you can do immunizations. And like, I didn't know. And it was almost like an ignorance is bliss type thing. Like, I
Mhm.
had no idea what I was doing. And once I started to, do some research and look into what's in the vaccines and some of the studies that are still available, some of the studies, around them, and side effects and things, I definitely took a step back. And
Mhm.
I, you know, I have a very different stance on vaccines now than I did before. And
Mhm. Mhm.
it just
But
really seems like a shame to not have had more information. Like, there was so much information, that we had to memorize, like about drugs, and
right,
treat,
side of
what to treat for what.
right.
But with vaccines, there was just not a lot, and that's still something that we're literally
Mhm.
injecting into somebody's body.
Yeah.
And yeah,
Mhm.
it's kind of wild to me that people don't take that a little bit more seriously.
Yeah. Well, I mean, it's a strange thing. Just because one can inject in the right place it doesn't mean that
Mhm.
it makes the content of what you're injecting safe, right? It's like,
Right.
yeah, and it's yeah, I've interviewed quite a few people about this. It's like, well, we're told this is what we do, right? So it's like, but have you read the ingredients? Oh, actually, we didn't really get the ingredients. Or, well, then how's informed consent even possible?
Right.
Right. And then patients too, or clients, whatever, they don't necessarily ask. They'll ask a few things, like, does it hurt? That's barely the issue, it's like, yeah. And then it's like, oh yeah, you'll have a little bit of pain in the arm, and it's going to stay there, which we know is absolutely not true. It's not even possible, biologically. It doesn't make any sense. And so many people, doctors and pharmacists and nurses have fallen for this. And then a lot of them were afraid to speak. And that's still happening here, because the moment you do, it's over. Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much. I wrote an article, just saying, well, let's, let people choose, but let's not forget that we actually have an immune system. Well, that was it.
You were marked after that, weren't you?
Yeah, that was it. It's like common sense truth, and that was the nail in the coffin, So it is shocking, so good for you for making the shift. There's always something that wakes people up and go, whoa, But so have you found now that you're able to help people that have received this new infertility verdict? Like, are there things that make a change, or with the other method that increases the circulation to the area, that have you found that there's something to do for these people, these women?
So I think it's a little bit too early to tell, because I've been doing this therapy for almost a year now. So I don't have a huge population that I've used it on. And honestly, most of the women that come to see me are already very holistically minded. So most of them have not
done this,
have not bought in, so to say. But I feel like if I did have a woman that came to me that had gotten the vaccine, I mean, I would treat her the same as my other women, knowing that she probably needs to detox from that, along with, working on gut health and managing stress and those things. But knowing that, I mean, there's a certain element of detox that probably would need to be done to hopefully be successful in conception.
Yeah. Like, I mean, it seems it's still, provided people don't continue taking this, it still seems manageable. Like, people can get help, that's, I guess, what I'm looking for, confirmation on that level. But, if you see mostly people who are already looking after their bodies, then it's not the right crowd.
But I don't think it's game over if they've had it.
No, exactly. But I think that's the point. I think it's, I mean, on the cardiovascular level, it seems to be fast, if those are the types that, if it got you on that way. But it seems to have so many ways of disturbing, our physiology and metabolism.
Right. And I do think too, going along with the infertility piece, some women that have gotten it, they say that they lose their periods for a certain amount of months, but then they do end up getting it back. So to me, if you're going back to cycling, your body is detoxing, you're getting back to that normal rhythm. So I definitely do think there's hope, looking at that piece of it.
Yeah, and I wonder too, whether it affects the. I mean, I've seen now there's a few articles affecting the breast milk, and therefore the importance of detoxing. Because we don't know. I mean, that's the whole thing. We're still in the experiment, right? It's not over.
We're still figuring it out.
What is it? January or February 2023? That's like, anyway, crazy stuff. So what have you found super exciting in your practice? Let's say from a condition that you would have then prescribed a drug or given out a drug, that now, knowing what you know now, you're able to do or change or help?
So a lot of things, but the most exciting one for me is the infertility, the women that are dealing with that, because when you're going through conventional medicine to get help in that area, you might get a few labs done, and a lot of women have fertility that's unexplained. And so if nothing turns up in the labs, there's nothing to fix, so to speak. And so they're pushed straight to a fertility specialist for IVF and IUI, which, in some women, granted, they very might well be their only option of getting pregnant, but they're very harsh and aggressive treatments. It's a big investment. It takes such a toll on women's bodies to go through all of that. And you're on the schedule of the clinic, and you're trying to, fit your body into their mold by pumping your body with all of these different medications. And then, you have the hormones and all of the emotions into it. And it's a very stressful, aggressive way to try to create a life. And so I feel like I can kind of be, working on gentle, natural conception is really a whole nother option that most women don't even know about, but it might be exactly what they're looking for. And so I just love to kind of help them and to tell them that it's okay. Like, we're not rushed. Let's get your body healthy first so that it feels safe to create another life. And then we see what happens. So I love it. It's so exciting.
Yeah. No. And have you found like this would allow you to generalize, because I know there's no one exact same case, but have you found that there's particular presentations or things you must address for these women who have infertility issues? Like, for example, their liver not functioning, or like, have you noticed any trends or
trends? Poor gut health. I do not have one one woman that comes in to see me that has optimized gut health. And I feel like in the functional medicine world, there's a lot of talk about gut health and its importance. But if you're not in that, you just have no idea. And the gut is so huge for everything. It's connected to the brain, the reproductive organs, our liver, our thyroid, everything. It's most of our immune system. And if that's not optimized, how can anything else be optimized? So that is really where I start with everybody.
Yeah. And like, to people listening here who are saying, well, I go every day, I'm good. What would be some of the common signs you see that would alert you that they don't have, oops, sorry about this. Oh, hang on. Yikes, I hope that hasn't stopped our recording. No, it hasn't. I'll have to deal with that. I'm sorry.
That's okay, no problem.
Let me just see if I can take that off. 1 sec. I thought I had it on airplane mode. Obviously not. This was going to be a highly edited half an hour. Okay, well, the problem, I don't know how to stop it from my iPad, even if I put this on the other. So hopefully they will feel that I nicely, rudely shut them down. and won't try it. Okay. What was I asking you here? Hang on a second. Oh, yes. So, yeah, my question was people who go, feel they go every day and they go, oh, my gut health is fine. I don't have any pain or whatever. What are signs that would alert you that they have gut issues that they may not be thinking about?
Sure. So I do have some people like that, that they think everything's fine, they don't have any pain or nausea. But then I ask them, well, how is your skin? Do you have, oh, well, I have eczema sometimes, and I have oily skin, and I get acne every month. And I go, well, the skin is very much connected to the gut. So there's that. And there's a lot of research and studies around reproductive health too, that for women that have very heavy, painful periods or irregular cycles, a lot of that can be traced back to poor gut health as well. Poor, bladder function can be connected to the gut. And then, thyroid issues too. There's a lot to say that there are parasites and bacterial infections that can affect the thyroid. So I do try to tell them that, even if you're not having symptoms in your digestive area per se, it still could be causing problems elsewhere in the body.
Yeah. So I think the misnomer here is people think gut health. So it's the quality of their excrements that is, okay, sure. Does it float? Does it sink? And, that kind of stuff. And does it come out?
Yeah. Yeah.
There's that.
Yes.
But, like you said, there's also the neurotransmitters. There's, all of the stuff that is created literally in the gut that, it's really like, it connects all our organs, right? So
Yes.
in that sense, we have to think larger than just what's coming out.
Right.
So anything else you want to share specifically about what you've discovered in this transition over, and maybe tips to having a good healthy pregnancy, or being fertile?
Sure. So, I think having the knowledge kind of from both sides is very helpful, because I know where, women that aren't not necessarily open to holistic health yet, I know where they're at. Because I remember I used to be, that used to be me. And so I would just tell them that if they are frustrated and this is their last resort, to not lose hope and to keep an open mind, especially about, holistic healing, in how we start from, supporting the body so that it can heal itself, and really learn how to be an advocate for yourself, to find a practitioner out there that will listen to you and care about you, because that is something that I hear a lot that makes me so sad, is there is such a distrust for healthcare professionals, and women feel like their practitioner or their provider doesn't listen to them, and doesn't have time for them. So take the time to, look and see who's in your area, and call them and talk to them and interview them and look them up on Facebook, and see what they're all about. Find somebody that's going to help you and care about you, because even though you might have a distrust, there are so many of us out here that are so passionate about helping you, and that's all we want to do. And I'm not a perfect fit for everybody, and you're not a perfect fit for everybody either, but find that person that is going to be that perfect fit, because I promise you, we're out there.
Great. I think I'll leave it right with that. And
Okay.
Thank you so much for your time, Nicole. And yeah, it's a great to learn about your history and this transition. And I think it's very hopeful for many people who are listening as well. Yeah, to have both sides a little bit in that sense, because we live in a world where it's like sides, and it really shouldn't be. It should be working kind of all together, right? But there's such paradigm narratives, let's call it that. The narrative too, right?
Yes.
Oh, so very good. Okay, well, thanks so much.
Thank you.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.